The nurse on duty prepared a trolley for the cardiothoracic surgical unit team for an invasive procedure called insertion of central line. This procedure involves cutting into deep vein of a patient using sharp surgical blades and insertion of central cannula and suturing of the deep vein and open wound accordingly. It is a bloody procedure that must be done under strict infection control, and the equipment must be properly segregated and discarded into sharp and color-coded waste containers. The nurse had already informed the team of doctors where the sharp box containers and the central waste bin is located for appropriate segregation and disposal of the waste generated after the bedside surgical procedure. The senior registrar that conducted the procedure consented and promised to ensure that the waste will be properly disposed accordingly. As usual, the senior registrar and other doctors left the house officer on the ward to document and possibly segregate and discard the waste generated during the procedure. However, to the dismay of the nurse on duty, who went to attend to another patient on the ward, the house officer left the scattered waste and the open needles and sharp objects at the patient's bedside and was tactically sneaking out of the ward. Having the suspicion of the nurse on duty, the house officer refused to segregate and discard the hazardous and injurious waste generated and negligently abandoned by the doctors at the patient's bedside. In her professional wisdom, the only way to avoid physical confrontation is to lock down the exit door of the ward so that the house officer can honorably complete the procedure that her senior doctors have left her to do.
To do her duty.
There is nothing anybody can tell me in this place.
If
a patient relatives does this to the doctor, they lock the person up. It's a lock case. This is harassment.
In their own reaction, a world press conference was convened by the Association of Resident Doctors, Obafemi Awolowo University Teaching Hospital, Ile-Ife chapter. The association observed that the situation as harassment. Hence, they decided and resolved to go on 2 days warning strike. My question is this: in whose interest? Patient's interest or doctor's interest? Yet, the Association of Nigerian Nurses has challenged the doctors to seek legal redress if they truly have genuine case and not to resolve on strike. Interprofessional disputes, interprofessional misunderstanding, interprofessional harassment or assault should never be a reason for going on strike. Was the nurse right in locking up the doctor? Was the doctor right leaving behind the waste that her team generated? Who will benefit from the strike? What is the objective of any strike action? These are the questions we should ask ourselves. Patient interest is paramount to every other thing that the health professionals might be doing. In whatever case that they might find themselves, the patient's interest, which is to get better, and both the professionals signed and consented to their oath to uphold the oath according to Nightingale's oath and according to Hippocrates' oath. Thank you for watching.